Which of the following is not a recommended step when responding to an exposure of a blood-borne pathogen? And if you're not sure what blood-borne pathogen is, blood-borne means that it lives in the blood, and then pathogen is something that is infectious. And a common example of an exposure to a blood-borne pathogen is a needle stick injury. So maybe if you're drawing blood from a patient and then you accidentally poke yourself with it, that would be an example of a blood-borne pathogen exposure. So option A says ignore the exposure if it seems minor. And this is definitely incorrect. You never ever want to ignore any sort of workplace injury, especially when there's an exposure here, such as a blood-borne pathogen. That could be very serious. There could be certain protocols to follow depending on what you could potentially be exposed to make sure you do not become ill from this. But since the question is stating what's not appropriate, and we know that this is not an appropriate course of action, that makes this our correct answer, because we know for sure that this is not a recommended step. But let's go through the other choices and understand why these are things that would be recommended. Option B says report the exposure to the appropriate personnel. And absolutely, you always want to report any sort of exposure to your manager so they could help work out with you the next steps and make sure that everything is taken care of properly to keep you safe and healthy. So this is definitely correct, but therefore we will eliminate it because the question's asking which is not correct. Option C says to wash the exposed area immediately with soap and water. And yes, the current guidelines state that you should immediately wash any wounds with soap and water to try and clean out anything that could be exposing you. So as you're washing, you're kind of squeezing the blood out because anything that you're exposed to, you want to get as much of it away and out of your system as possible. So we'll eliminate that because that is an appropriate course of action. Option D says to follow post-exposure guidelines and seek medical evaluation. And absolutely, when you go to your appropriate personnel to report the incident, they will likely send you to some sort of employee health center, or if you're working in an office that doesn't have that, they'll send you maybe to the emergency room, maybe to some sort of provider, just to make sure that you are seeking care and following the correct course of action on what to do and to test if you really were exposed to anything within the blood. So we will eliminate this because this is a recommended step and the question is asking which is not recommended. So options B, C, and D are absolutely what you should do when you have an exposure to a blood-borne pathogen, which makes option A, ignore the exposure if it seems minor, the correct answer because this is what you should not do in this situation.